Joy Milne, you know her as the woman who can smell Parkinson's. Joy, what is the big news today?
Today, we have released the fact that we have now discovered a way of diagnosing Parkinson's by a simple, non-invasive test.
That's Joy Milne from Scotland. She's known the world over as the woman who can smell Parkinson's. She smelled her husband's Parkinson's 12 years before his diagnosis. We first introduced Joy on the podcast in June 2019 at the World Parkinson Congress in Kyoto, Japan.
He was 31, just before his 32nd birthday. And I said to him, Les, you're smelling, you're not washing enough, which didn't go down well.
And now, because of that nose, the diagnosis of Parkinson's may be a 3-minute test. I talk with Joy and Professor Perdita Barron at the University of Manchester. She is the director of the Michael Barber Centre for Collaborative Mass Spectrometry. Joy, Perdita, and Perdita's team have been working side by side, hand to nose, for years now, identifying what exactly it is that Joy smells, and if it can be used in a way to diagnose Parkinson's.
What we have released today is some work we've been doing to try to build on our prior discoveries, which is that people with Parkinson's smell differently. And we have found that the smell is most concentrated in a oily substance. We have it, you can see it on my head a bit. We have it all over our body, actually, not on the palms of our hands and the soles of our feet, but everywhere else. And that substance is called sebum. And it's oily, so that's good. And what we've done in this work is we've taken from people with Parkinson's, just using a Q-tip, just using a cotton swab. We've swabbed them on their back. And then we've taken that Q-tip and we've rubbed it on a bit of paper. We've taken the bit of paper, added a bit of solvent to it, and then clipped just a little crocodile clip so that we can apply some electricity to it. And we put it next to the mass spectrometer. And when we apply the electricity, the molecules that we took off people's backs are mixed now in the solvent, and they spray out. Oh, we cut the paper to a tip, so it's a little triangular piece, and they spray out into the mass spectrometer. And what happens then is they very, very gently lose the solvent, and we can weigh them. And when we do that with people with Parkinson's disease compared to people without, we see that there are some really big lipids, that's fat molecules, that are more, there's much more of them in people with Parkinson's. So we are able then to say, and in fact, there's about 600 that we see that are differently regulated and mostly upregulated in people with Parkinson's. So we're able to use this method, which is really just spraying your sebum from a bit of paper, to tell whether someone has got Parkinson's or not.
So this is a biomarker?
So what we found is that there are some classes of lipids, and these are in the acylglyceride category, triglycerides and actually larger acylglycerides, that are definitely substantially upregulated. And we now pose them as something that could be used as a biomarker. What we are excited about with this method is it's very similar, or much more similar to what we've done before, to a method that's used in hospitals to test people for other diseases. So we are getting closer to being able to do something that really could be used in clinic usefully.
Now, Perdita, do you remember when this went from Joy being a novelty to you realizing, wait, there's something here?
Yeah, I do. And I was really skeptical when Tilo first told me that this lady had, asked this question. I was skeptical, and I just thought she was just smelling older people and associating their smell and perhaps their movement with Parkinson's disease. So I was a skeptic, but it was both meeting her, because she's awfully convincing, and also in that very first work that we did, there was one participant who she'd scored as having Parkinson's, who did not have Parkinson's, but actually he came back and told the team that he had just been diagnosed. That was about 9 months after Joy had smelt his t-shirt and said he had. So that was really enough to convince me of Joy. What then we had to do was see if mass spectrometry could do it, see if analytical science could do it, and that's been a longer journey.
Joy, what do you think the impact on the future of patient and care partner assisted research is based on this result?
I, as you know, have trained in general practice, and I am an advocate of earlier diagnosis. I see it in cardiology, I've seen it in diabetes, I've seen it in stroke control, post-stroke control. So yes, the advantage is earlier diagnosis, apply exercise and diet straight away, but also there are things in the pipeline. There are medicine in the pipeline, so people should keep themselves healthier, more active, then the treatment will be there.
Perdita, the question is going to come from the Parkinson's community, especially people with Parkinson's. Why should I care about this?
I think it's harder for people with Parkinson's, except you have to take yourself back to when you first had symptoms and you weren't sure, and particularly for those like yourself who had them when they were younger, you weren't sure, your family probably weren't sure, and your clinicians probably weren't sure either. And so our real aim now is to make a clinically relevant confirmatory diagnostic, such that when people present with one or two of those early difficult symptoms, this is a cheap way of saying, yeah, actually, this is what you've got, or no, it isn't, which would in many cases be useful. So I think that's why people with Parkinson's should care. I think it's for what's, it's for their future selves, I suppose, or their themselves.
What is the potential, not just for diagnosis, but for following the progression of Parkinson's with this and with intervention?
Yeah, so we have got some very small indicators, not in this work published today, but in other studies, that we can see changes that occur over a 3-year period. We've done a longitudinal study and we'll be publishing that fairly soon. So I think there are some indicators that we can do that. It's a much more complicated form of medicine, that it's precision medicine, and you have to take into account all of the other things that are happening to that person, their nutrition, their environment, and so on, to be really certain. But I do think there is some opportunity for the method that we're using to be used in that way. What we need to do that is to really follow individuals carefully and to get feedback on what they're doing, which could be self put in. I think where there is a greater opportunity is in clinical trials for potential medication with a high likelihood ratio groups, so groups mostly with genetic predisposition to Parkinson's. And there I think our method could potentially inform the trial people about the people who would convert to Parkinson's versus the people who wouldn't, which would of course be useful. So I think that's where we may have our second hope to do something good now.
And so this test that we've discovered that we're announcing today, I understand that it's extremely faster than other clinical mass spectrometry approaches. Like it's you can find out in 2 to 3 minutes, right?
We can find out in 2 to 3 minutes, and we can do it well. It's important for 2 reasons. It's important because you're not using much machine time, and machine time is what's important, actually, is what's costly. So it makes it much more cost effective to do that. It's not that it makes a huge difference to someone whether they're diagnosed within 3 minutes or 3 weeks, but it makes the test much more cost effective, which means it's more amenable to what we were talking about before, potentially prognostic screening, but also to not taking up too much of the resource of any hospital if we wanted to introduce this as a confirmatory diagnostic. So at the moment in Manchester, there are around about 18,000 people waiting to see a neurologist. We have huge waiting lists in the UK at the moment. I think this is the case in many countries post-pandemic. And if we could run a rapid test, we could run all of those 18,000 in about 3 weeks with our test, and we would be able to make some referral or assist the referral process in that case. You know, most of them will not have Parkinson's, some of them will. We would be able to assist it. So that's our goal, is in 2 years' time to be able to run a trial in the Manchester area where we really can see whether this could work as a confirmatory diagnostic for those people on the referral pathway.
For Les, as a doctor, once we had discovered this, he almost became the old Les again. He was investigative, he thought about
what it meant. The night he was dying, he made me promise that I would continue and I would do this research. And I have to say, it has paid off. I mean, it is wonderful what the group have done, and he would be very, very proud of how they have worked with it. It is tremendous.